We talk a lot about nutrients, and you've mentioned before that if you are taking certain medications, that can somehow rob your body of the nutrients that it needs. How does that work?
Yeah, I mean, there's multiple ways that works, and I think it's a gigantic issue in our society, and I think I mean, I wasn't taught it in medical school and residency. Most doctors don't even think about it, yet the evidence, I mean, there's gobs and gobs of evidence on how, certain nutrients are lost in the face of taking certain medications. Now, whether, the medication inhibits the conversion of that vitamin and mineral, whether it affects absorption, certainly your acid-suppressing medications have a big factor in regards to that, but, there's other medicines that just inhibit the body's use or increase the body's excretion of that.
Okay.
And I think it's a really big issue. I mean, if you take the example of diabetes, if a patient shows up to the doctor's office with high blood sugar, they're given metformin.
Okay.
So relatively inexpensive. It's a good diabetes medication, but metformin depletes folic acid and B12.
Oh.
So if you fast forward 5–10 years and this patient has good, good blood sugar control, but they're on the metformin, and all of a sudden now they have numbness or tingling or burning, they're told it's from the diabetes, when in fact, the depletion of folic acid and or B12 can cause neuropathy.
I'll be darned.
So we give another medicine to treat the neuropathy, potentially depleting other nutrients, and so we can't turn a blind eye to this anymore. I mean, there are books about this. Drug Muggers is a recent book written by a pharmacist that gives that. We created a website to help be a calculator for that called Mytavin, M-Y-T-A-V-I-N, just to kind of expose people to the idea that you might be depleting nutrients and your symptoms actually might be caused by that, and not your need for another medicine or something more aggressive.
So if you're on a certain medication for a condition, is it best just to make sure that you also take a multivitamin, or do you really need something more targeted than that?
Well, it's a good question. I think everybody needs a multivitamin, whether they're on a medication or not. I think it just provides a good insurance policy.
Okay.
And I don't think, it means everybody needs to be on specific supplements, but I think you need to pay attention to, okay, I'm on this medicine, I know the side effect list, people are really in tune at reading that, but do you know what nutrients this is depleting, and do you know what those symptoms are? Because we want to pay attention to those.
Okay.
Most of these nutrients are very inexpensive, they're very safe. Why not protect yourself, get the benefits of the medication, and protect yourself from the side effects? And that's a win in the long run.
Absolutely. It makes a lot of common sense anyway, but just something not a lot of people might know about.
Well, not a lot of people, and again, I mean, physicians don't know it. Our brains are only so big. We can't house all that other stuff. But it's a real issue, and the more medicines I've looked at, the more data is there. And again, it's in the evidence. These things are depleting nutrients, and we need to pay attention to that. And
people, I think, doctors have said for so long, especially on this show, you need to take control of your own health. And you need to kind of be an informed consumer.
And that's becoming more and more of an issue. I mean, doctors, and especially primary care doctors, are getting busier. They're spending less time with patients. I mean, patients really have to take control. I mean, we now started sharing all the files with patients, and so they can monitor that, they can track that.
Wow.
If there's a lab value that they see is off, I may overlook that, or you need to be empowered as a patient, and you need to take full control of your health.